The menstrual cycle is a natural process that happens in a woman's body every month. It involves the shedding of the inner lining of the uterus, which is released as blood. This process is called menstruation. It usually happens in women of reproductive age, meaning those who can have babies between ages 12 and 51. Menopause is when a woman stops having periods for at least 1 year. The menstrual cycles usually last around 28 days, but it can vary from a person to a person, with cycles ranging from 24 to 38 days. Periods can be irregular, especially in the years after a girl starts menstruation and before menopause. A normal period usually lasts from 4 to 8 days, and the average amount of blood lost is about 2 tablespoons. The heaviest bleeding typically occurs on the second day. Menstrual blood usually does not clot, except when there is heavy bleeding. The menstrual cycle has different phases. Phase number 1, which is a follicular phase. This is when the egg follicles in the ovary start to mature. Phase 2, which is the ovulatory phase, when the mature egg is released from the ovary. Phase 3, which is the luteal phase. After ovulation, the empty follicle turns into a structure called corpus luteum, which produces hormones to prepare the uterus for a possible pregnancy. During the menstrual cycle, hormones like estrogen and progesterone play an important role in controlling the different phases. These hormones help regulate the growth of the egg, the release of the egg, and the preparation of the uterus for a potential pregnancy. If pregnancy does not occur, the corpus luteum breaks down, hormone levels drop, and the cycle starts again with menstruation. If the pregnancy happens, the corpus luteum continues to produce hormones to support the pregnancy. Thanks for watching, and I'll see you in the next one.